Everybody, welcome. Again, my name is Derek Robinson. I'm the academic representative for all District 11 ASDA. Today, I'm going to be having a conversation with Dr. Todd Alpert with an A, middle initial H. That's my fault, so definitely don't call him Dr. Halpert. And we're going to be discussing a whole ton of things. We're going to try and go in as much order as possible so we have the opportunity to get to know Dr. Alpert and how he made his decision and how he's doing now and everything that he's experienced with Aspen Dental. So without further ado, the man, the myth, the legend, number one in your hearts, everybody give it up for Dr. Todd Alpert.
All right.
You like that?
Yeah. What do you want me to start talking off on?
Yeah, so as of right now, go ahead and introduce yourself. Go ahead and kind of just share a little bit about yourself, where you're at, where you went to school, all that. I know a lot of them know that, but just start off there and then we can go from there.
All right. So my name's Todd. I'm currently working in Klamath Falls, which is like the southern part of Oregon near California, at that Aspen Dental as the MCD there. I graduated just last year from UCSF Dental. And I just wanted to go straight into practice, and I figured corporate was what I was looking at after kind of like looking at all the different avenues.
Awesome. So with that said, we'll definitely get into conversation about that. What I also want to do as well is offer an opportunity for people to look into this as a part of one of our nice little resource opportunities. So as of right now, we are offering free CE opportunities to essentially all current doctors, whether they're in the Aspen Network or outside of the Aspen Network, as well as all dental students. This is in response to this crazy time of COVID, and this is an opportunity for you to get a little bit of those CEs that you want to experience so you can get ahead of the game prior to graduating, or if you've already graduated, getting that opportunity in order to learn a little bit more. So we'll definitely cover that in the resources part with Dr. Alpert. If you want to check it out afterwards, and I'll make sure to mention this part before we leave as well, aspendentalce.com/welcome, and you can fill out all the information. There's thousands of opportunities for you to check out, as well as a library of other CEs that have been done. So with that said, Dr. Alpert, what was your most memorable experience at UC San Francisco?
I would have to say it's probably like the first time you work on patients, like your first day in clinic. I wouldn't say it's like a good memorable though. It's just like you're in clinic and it's like the first time you're the doctor and you have a patient. I mean, that's something I feel like you never forget just because of, I mean, as exciting as it is, it's really stressful. And, patients know. So I thought.
Do you remember the first patient that you had and what the procedure was?
I do. And it was just a full exam. And I remember I lost that patient because they could tell, that you don't have the confidence. So
you lost the patient? He or she died?
No, like she just was like, oh, I don't want, no, yeah. It was like, yeah. They were like, I don't think I want him. And I totally understood why, but it was like a big learning experience right there.
It's a nerve-wracking part, so I get it. We got a couple questions. I'm going to make sure to address those as well. Let's do this one. How did you manage the whole job searching process while in school? And when did you know when you were ready to make a decision?
Okay, so that's really good. So I would say my first couple years, I was more like, hey, do I want to do a specialty or not do a specialty? And then once I kind of narrowed that down to, general dentistry as like a specialty, I guess, what I picked. So then I was like, okay, I should probably start doing the jobs hunting because that's kind of what you do. And while everyone else is like studying for exams to take boards or for like applying for ortho and not doing all of that, I focused on which company do I want to work for? What do they have? So that's where I geared my energy. So if someone has time to study for like oral surgery boards, you have time to study for figuring out which company is right for you. So I think once you decide that you want to be a general dentist, then it's a lot easier. It's not like there's infinite amounts of companies. There's only a few. And then I feel like once you have, I would say like my third and fourth year, once you're in clinic, you can kind of control your schedule a little better. So that's when I was able to do a lot more of going to those events, talking to people, I mean, just like you, how you go out to the schools and then asking
Didn't
the
we meet
questions.
there? We met there too, right?
Exactly. Right. And then just asking the questions that really matter.
Yeah, totally. So I know you mentioned real quickly, like your first experience meeting somebody. What was the biggest difference in flow from clinical rotation in school and then going into, Aspen Dental and the craziness of that?
Okay, yeah, so that's really crazy because when you're in school, like once you get pretty fast, you can see what maybe 3 or 4 people in one day. Aspen Dental, the first day I got there, it was right away. The schedule had 35 people on it, and I asked the doctor because it was a doctor mentoring me, so she was the one running it, and I was watching it,
Yeah.
and I was like, "Hey, like, who's helping you with this?" You know? And she goes, "This is my schedule for the day, 35 people." And I was like, what? Like, how does this work? But then I realized it's because the way Aspen Dental's design is with a big support team. Like the dental assistants, the front desk, like it's fully loaded so that you just really focus on your part and nothing extra. So seeing like 3 to 4 patients in 1 hour for the whole, per hour really doesn't amount to more than, I would say, 45 minutes out of the 60 minutes. I still get like 10 to 15-minute break every hour, even seeing 3 patients per hour, which I never thought was possible before.
Yeah. I mean, I'm sure you looked at it and I'm sure you were super overwhelmed by the
It
vision.
is, yeah.
So I got a couple questions that came in live. Maybe you can help with this since we're kind of on this topic, but if you have ever had the opportunity to visit a private practice and experience that versus what we call corporate dentistry, like the DSO model, what are the pros and cons of what you would say are working in corporate dentistry?
Okay, so I started off in private. That's how I figured out like I wanted to dentistry because that's where I started shadowing. And I
Hmm.
think that was a good place to shadow because it's like really calm. We saw like one person per hour. The schedule was like 8 people. It was really slow. You could take your time. However, like someone doesn't show up, there's like a whole hour where you do absolutely nothing. I felt like the money, like you had to really like be on top of more things in those cases. Like you have to do more of the business side of it. So I felt
Hmm.
like that was more stressful because at the end of it, you worry about all that more. Unless you're like an associate, in which case I noticed that usually like the head doctors give you the stuff that they don't want to do, which is not what Aspen is like. Aspen is you get to run your schedule your way, which I didn't know if that would actually be the case once I got there because everyone says that, but it turned out I really get to pick like exactly what I want to do, how to plan my schedule. So yes, I see a lot more patients, but I think it's a lot more exciting. There's never like a dull moment, and then I run everything like my way. So
And it's very efficient, right?
it is, yeah.
It's like a well-oiled machine. Yeah, and I think a lot of the time there's that misconception of, all of a sudden I'm gonna get thrown into the fire. No, necessarily what happens. Care to explain a little bit for like your first couple weeks or first month how
Yeah,
they let you kind of start off slowly and make
yeah,
you experience that part?
of course. So I looked online and I was like, I saw like some people had bad experiences with Aspen where they're like, oh, they threw me in. It was like year-old reviews, but I was like, oh, like I hope that's not at all what it is.
Yeah.
Well, I went in and they were like, hey, like we want you in training for 6 weeks. And I was like, oh, okay, like they're not throwing me in at all. Like training for 6 weeks is easy, like that's plenty of time to learn it. After 3 weeks though, I was actually the one that was like, can you throw me in? Like I've had enough. So I actually cut my training 2 weeks short. So after 4 weeks, I was like, hey, like I want the training wheels off. Like I'm ready to take on my 30 plus patients at this point. And I didn't think I would get to that point. Like I was always like, it was always so comfortable, like having someone over you. But after a while, you're like, no, like let me just go ahead and do it all. So
Yeah.
it was actually the opposite. They were offering more support than I felt like I wanted.
Yeah, and I'm sure you can agree, even though you may not have gone through it, but it's like a little mini GPR, a little mini AEGD kind of included, right?
Yeah, it's crazy. Like I was gonna say, so like probably like the third day in, they were like, okay, here's a full mouth extraction, and I was like, what's that? Like they're like, oh, like you're taking out, 25 teeth. Here's upper and lower denture ready to go, and I was like, oh, like how long do I have? They're like, oh, what do you think? Like an hour and a half, and I was like,
Yeah.
But then I was done in like 70 minutes. So then I was like, oh, I get it now. So things like because in school you're always taking out one teeth, like one tooth at a time, maybe two. And then all of a sudden I had 25 in an hour and a half. So you like learn super fast and you just get, I don't know. It was great though. Like I just felt like I learned 10 times faster than I did in school.
Yeah, that's great. And just to add on to that, our program that we offer for the first essentially 30 days is called the Doctor Development Program. It basically, you're doing little to no physical work unless you're like Dr. Alpert and say, you know what, I want to start doing it immediately, and then you have to beg and plead for them. But at the same time, you're going through this training to make sure that you understand the full clinical autonomy in that office and working with them. And that's kind of the fun part, is understanding that, you know what, you're not going to get thrown into the fire. It's going to be a slow, gradual process. And once you get in that office and you start working, you're going to hit the ground running. So I think that's a really fun part. We're going to backtrack just a tad. We got a question. I know that we were talking about you and the whole interview process. So what sort of questions matter when it comes to going and talking to those companies? Were there certain questions that you were asking that you felt like were super effective questions to ask? And my guess is this is advice from a dental student that is very ready to start asking these questions to other, other doctors and things.
Yeah, so I think one of the first ones was location. Like, is it even somewhere that you'd be willing to go? Like, if you're not willing to, let's say you want to move to Nevada and there's no Aspen there. I mean, that's a quick one, like your location. I thought the next one was hours. Like what's a typical week look like? How flexible is it? Because some companies, it feels like I would talk to and it seemed like you couldn't get a single day off, or you'd be working so many hours and you're stuck with it. Then what type of dentistry are you doing most of the time? So what do you hate doing? What do you like doing? If you hate doing extractions, like absolutely do not do Aspen Dental. I think that's just like goes without saying, because that's like the thing you do almost like every single day. But if you like love them, it's like, man, this is your company. Whereas I've heard other ones try to refer out all the extractions. So that was another like really good question. I say asking about like if the pay is comparable to other ones, like how the bonus system works was really big for me. And then also moving up in the company, like are you stuck as an associate or can you quickly move up? So that was like a really easy one for me with Aspen was, yeah, they were like, yeah, you could go from associate to the managing clinical director, the
Yeah.
MCD, the head of the office, and then to being the POP, the owner of it. And it's so true. Like I started off as an associate for 1 month. I transitioned into MCD. And then in January, which was, I would say like 4 months in, they asked me if I wanted to buy the office. I said no, because I didn't want to live here, but the opportunities were all there.
That's awesome. And, I think you brought up a good point. We slowly just went right over this. MCD stands for Managing Clinical Director. That's a lead doctor. And that, just to confirm, that is your current title, right?
Mm-hmm.
POP, Practice Ownership Program, that is where you have the opportunity to purchase the practice that you're currently practicing or have the opportunity to own other practices. We'll cover that part a little bit later because I know we do have some more questions on that part. What about for those that are considering AEGD or GPR? Like, what is your recommendation for those individuals that might be looking into that?
Yeah, so I mean, what I've seen is like if you go into those programs, like really get into a program where you're gonna do things that you can't do like working for a company. I would say like if it's gonna be something that's like heavily implant based or I don't know if you want to do some sort of like complex oral surgeries or something, then I could understand going into that because it's true. Like no one really trained me how to remove tori or some of the other big surgeries, which I do shy away from them. Whereas I feel like if I did go through a GPR, maybe I wouldn't shy away from it. But at the same time, like I learned a million other things. And so I felt like if I just asked another doctor, hey, can I come shadow you on a day that you're doing a tori removal? I could really just learn it at that point. So I don't know, in that case, I just didn't see it being a benefit doing those programs because it's not like there's no guidance at Aspen. Like you really do get all the support. Whenever I run into problems, I just contact another doctor and I'm like, hey, like here's a picture. I'm stuck. What do I do? And they just always help me. So it's not like I don't have mentors if I do need them.
Yeah. I mean, I think too, and I'd be happy to take a shot at that question too, especially if you're uncertain about what you want to do, if you're still kind of just a little bit behind as far as understanding what you like and what you don't like, or also having a very, very hard time with certain procedures that you feel like are going to be overwhelming to you. Obviously, a dental support organization will help with those things. However, another option and alternative is that route, right? And then additionally, AEGDs are a little bit more on the academic focused area too. So if you want to kind of be in that focused area of the academia side and stay within that particular realm, AEGDs are also a good option. Nonetheless, every person's different, and if there's any questions or any details that anybody wants to go into about that, feel free to contact me. Here we go, another question. If I start as an associate, and you kind of went over this already, how quickly can I become a lead and an owner?
Yeah, I was gonna say, so I got it within a month because I found out that the MCD was leaving. They offered me the position. Once they see that you can hit numbers, which you also want to see that you can hit numbers because you don't want to buy an office if you're going to run it down, right? You want to make sure that you're able to keep up with it. So at that point, that was like January. So that's when they saw like, okay, you can actually run an office. Then they were like offering it. So if you go somewhere where an office is not purchased, which you can look up on their site or just ask, then yeah, you can pretty much buy it after a few months of, getting the profits up. Yeah.
Yeah. And, also as well, this is a big part of it that they look into too. What about like your ability to communicate and lead within your own particular office?
Yeah. Well, I was going to say those go hand in hand though, because if you don't have that, you usually don't have the profits either, because if your staff doesn't like you or get along with you, the communication's not there. You have a lot of cases going on. Like I said, you're seeing that many people in one day, you need help. So if everyone's not working together in your office, your profits like quickly go down because cases will get lost. If your staff isn't friendly, people are less likely to sign up. It's just like people can sense an atmosphere. Like a lot of times people come in and be like, oh, I love it here. It's so much friendlier than other offices. Like you guys actually sit down and talk to me. If you don't have that, people are like, I'll just go somewhere else. So they do really go hand in hand.
That's great. Yeah, and the word that we like to use when we go in and talk about it is full clinical autonomy, right? Having the ability to, first of all, it's your license. You get to do any procedures that you feel comfortable with. And I'm sure you can attest to this. If you don't feel comfortable with something, there isn't anybody sitting there trying to force you to do it,
Nope.
right?
Yeah, right away I told them, I was like, I don't want to do root canals. So it was just, that whole setup was just put away. Yep.
Okay, and then talk a little bit briefly, and I know we're going all over the place, but I think this is kind of fun that we're doing it like this. What about, if there's certain procedures that may not necessarily fit in, do you have any other specialists going into your office? And if so, how long?
Okay, so we are just developing here. Kind of has like a bigger, like super office. So now we have an endodontist that comes through once a month. But before that, we didn't. But most offices do have an endodontist who comes. I feel like they start out once a month, and then if you need them more, they can come more. But typically, it's hard to fill an endo slot just because they're expensive. And then other offices I saw also have like oral surgeons that come through. And then the Invisalign actually you do yourself. So it's kind of your like the orthodontist because you work virtually with an orthodontist while you're doing the Invisalign. So that one's like, there's a specialist that you work with, but he doesn't come in the office.
So on that note, how many people work inside the average office, or at least from what you've experienced? And I can help you out with that too.
Okay, yeah, that's a good one. Because there's like one mega office here where it has like 3 doctors, so like tons of staff. But that's like more of a mega office. The typical office that I've seen is it's one or 2 doctors, 4 dental assistants. But usually you only bring in 3 for the day if it's just 1 doctor. So there's always 3 people helping me. There's 2 hygienists. Let's see. 3 front desk, a lab technician, and then you're like the manager for all those people. So it's a big group actually.
You're the big hoss, aren't you? Not only that though, right? Like endodontists and potential oral surgeons are going to be going in and out of there as well, right?
Yes. Yeah.
And we're, if not the only company that offers the lab technician in every single office. So, you know, when you're doing these procedures, you just walk over and knock on their door, and that's pretty amazing to me, I think. But I mean, you're ranging anywhere from like what? It can be from 7 to like upwards of 15 people that are going in and out of the office at any given day. Does that sound about accurate?
That's what, yeah. And actually, because before COVID, there's also like support stuff that come through. Like it'll be like a regional manager and a hygienist manager coming through. So yeah, before COVID, like there were like other people coming in. Now it's like kind of like narrowed down a little, but yeah, there were days where it was like 14 people there, which is like really busy.
You got a lot of friends, and you get to boss around a lot of people, is what it sounds like. Okay, question. This is kind of going back towards the student transitioning into a doctor. So this question was given yesterday. How much did you save to get over the gap between graduation and your first paycheck? And on top of that, is it still beneficial if I'm having to take out loans, or is it inevitable to get through those couple months?
Yeah, I was gonna say, so I think I had 2 months in between. So I feel like during those 2 months, I spent like $2,000 just like having fun. And then after that, I spent about 5,000 for my startup fees. So like putting my security deposit, getting my like licensing fees. And then I got dual certified for Oregon and California. So then I had to pay that extra fee, and then plus your DA license. So I would say, I mean, I personally spent 7,000. I just put on a credit card and then paid it off within a couple months.
Okay, so it's possible to do it without having to take out like an extra big loan or any of that.
Yeah, I was like, if you just have a credit card, I was like, you'll make the money back. And then also, I was gonna say Aspen offers like a relocation bonus typically, or some sort of compensation when you first sign on. So that helped with it too.
Well, and just to clarify on that part too, that because every office is 100% operated typically by an owner, whether it's a doctor owner that is a part of Aspen Dental Management, which we call large group practices, or if it's owned by a POP, a practice ownership program, and a working owner doctor, every single location has that negotiable ability, right? And so when you were working with it, you were discussing this with the individual that is either in charge, or the owner that's specifically in charge of that office, or an Aspen Dental Management practicing doctor that owns multiple practices but helps a little bit more on our side. And so all of that is negotiable, and those are the opportunities, and those are the things that you can ask regarding is relocation fees and things of that sort, which is great. So I know we briefly went over this, and we'll probably talk about this more often. What perks are available for a doctor straight out of school, and which ones did you use the most? That's including like the DDP, the development program and all that.
Oh, I'm trying to think. So, I mean, do you mean like all the CEs that are available?
CEs, stuff like that. I'm assuming that's what they're referring to.
Okay, yeah, because I know for me, I wanted to take the CE courses. So there's like a huge implant one, a huge Invisalign one that you get certified through. I don't know what other perks there are.
Well, I can talk. I know a lot of them are kind of just embedded into the experience, but like, the relocation assistance that you're able to take advantage of, and the doctor development program, where the first 30 days you're basically kind of going through the whole thing. What about Edge? Did you go to Edge?
No, because I was signed up and then COVID happened.
Oh, okay. Well,
you're right, though. There are a lot of trips you can take, because technically the Invisalign one was you take a trip to Chicago, but of course now it's like online. And the implant one was also, I think, a trip to Chicago. So that one, and then there was the Edge session. So I got 3 trips canceled. I mean,
but it's all temporary, right? I'm sure.
Well, but now I take courses. So
yeah, in a COVID-free world, you're basically going to be doing. These are the different perks that you can take advantage of, is getting implant certified, Invisalign certified, all the different CEs on top of Edge, which is a course. It's a week-long course where you're basically extending your knowledge on top of thinking about the next opportunities of becoming a lead doctor, an owner doctor. And we usually send you with like 30 other people, 30 other doctors. So it's a networking opportunity as well, on top of doing live dentistry. in order to kind of ask questions, understand the metrics and the analytics that are involved in any given office. Those are all the different opportunities. But we're hoping eventually when COVID goes away, you'll be able to take advantage of that too, right?
Hopefully.
Okay, let's get into transitioning from school to working as a new dentist. So what procedure, and I know we went over this too, what procedures do new dentists do?
Oh, I was like, you do everything that you want to do. I was like,
It just,
yeah, no, it's true. You really get to run your own schedule. So for me, I found that I love doing extractions and crown preps the most. So then I prioritize them in my schedule. So pretty much every week I have like, I don't know, like maybe 8 crown preps and then like tons of extraction cases. You have to, a lot of people want partials or dentures. That's why the lab technician's there. Fillings I found were like the most boring for me. So those I always put like less in my schedule. But if you're the opposite, I mean, because they all make comparable amounts of money, it's really just where you want to focus. Like my schedule is packed. So I feel like with that, I get to choose more of what I want to do. Obviously, if your schedule is empty, you just put everything in there and you do everything. But since I'm able to pick and choose a little more, I put off fillings more and focus on the other stuff. Yeah.
hey, it's your license and your practice. That's what you get to do, right?
Mm-hmm.
We got 2 questions that actually came in regarding implants, so we might as well just go into it. I really want to do implants. Does Aspen do implants?
So you have to make sure you do pick a site that does implants because not all Aspen offices do it. They're just rolling it out. So like the office I'm currently working at won't start doing implants until January. So I never got the chance to do them. However, I'm getting transferred this December over to like a Portland office. So that Portland office does do implants. So then I will be doing them. So you might not start off in an office that does implants, but you always can let them know, hey, I want to transfer. And I let Aspen, whoever it was, know from the very beginning, hey, I want to transfer to an office that's doing more things. I want to get trained in, all these other things. Like I wanted to do Invisalign implants that weren't offered here. We do offer Invisalign now, but we didn't before. So that's another thing you have to, that's a good question to ask before you get placed somewhere. But then again, you can also be patient about it and then just get transferred and do it later if you don't mind, which I really didn't because I feel like there were so many skills I wanted to hone in on before I wanted to even like tackle implants.
And also on top of that, these owners, if they own the office, they have that decision. So offices will have them. Other offices are slowly, gradually getting into offering implants. But the nice part is if you go into an office that's owned by a POP, an owner doctor, and they want that, or if you want to become an owner doctor and you want CBCT in there, you have the ability to do that, and it comes at a heavily discounted rate, which is really nice. Aspen paid for you to learn implants in CE? That was the question.
Yeah, everything. Yeah, because everything's paid for.
All right, nice. That's good. Okay, let's get back to the questions. These are some from the other day. Okay, so I know you briefly went over this, but let's talk about it again real quickly. How many patients do you typically see in a given day now?
Okay, so yeah, there's like 40 people on there. Out of those 40, only about 8 of them are actually like procedures, like a filling, a crown, extraction. A lot of the other ones are more like steps getting towards, there'll be like 10 that are steps in progress towards like a denture or partial. So those ones are like 5-minute appointments. So those are really quick. Other people, then there's like another 10 that are like adjustments for, someone needs a filling quickly adjusted or a denture quickly adjusted, which a lot of the times FDAs can do a lot of that also. And then another 10 would be like, I don't know, like impressions or something random like that, which if you have FDAs and, there's a lot that they can do. So that's why I was like, even though it's a crazy looking schedule, if you know how to delegate, it really isn't crazy at all. And then plus there's a hygienist who have their own patients and then they need you to come do periodic exams. So that's kind of how that 40 number comes up because you kind of see everyone's patients, but you get a lot of help.
Wow. Sounds like.
But you run around all day. You do run around.
Yeah.
Don't get me wrong.
That's great. Okay, we're going to backtrack just a tad. What did you do to start tackling your loans after you graduated dental school? That's the first part of it. Did you aggressively start paying them off, or did you allocate a majority of your income towards buying a practice?
So I was gonna say, so it depends on your loan. So like one of my loans, it's like you can't pay it back earlier than 10 years, like because they want to collect interest on it. So with those ones, it's like, well, you just do your monthly payments for the 10 years and you know what I mean? But the other ones, I'm definitely trying to pay them off earlier, but not that much earlier because I feel like some of them have low interest rates, whereas you can actually use your money to invest it into the company. Like let's say if I want, like right now I'm saving up to get towards POP, which is like, then there's like much more opportunity for income. And I feel like that interest rate really doesn't offset the amount of, that you can get out of owning an office. So I would say like not putting your money towards loans if their interest rates are low.
There you go. That's the advice from the pro right there. Let's continue on with the financial side of it. We'll definitely kind of go into this a little bit. However, I received a couple questions, so let's go into this and then tread lightly around it. But what are the salary ranges in Aspen on the West Coast? And then is it based on production? Is there loan repayment programs?
So I can answer the second part if you answer the first one.
Okay. Yeah. So, salary range again, because owners, the owner doctors basically are in charge of hiring their doctors. That is a negotiable part. And essentially we do something called a daily guarantee rate. And that's can be anywhere from, $450 a day to as much as, for some locations that are in the middle of nowhere, or we're having a hard time getting doctors to apply, upwards of $800 a day, which is really nice. In the whole grand total of it on a yearly basis, you can be making as an associate anywhere from $140,000 to even as much as over $200,000. So, obviously, if there's many factors that go into that, and if anybody has any questions about that and wants to go into a deeper conversation, feel free to let me know. So, on your note, is it based on production? Is there a loan repayment program?
Okay, so I have heard that there is a loan repayment program, but you have to like ask about it because I hear then they change like the way you get paid, so it kind of like offsets it a little. So it's not worth it for everyone. So I think it's something you have to discuss. But yeah, it is based off of production, just like any job. It's like if you're not bringing in any money, like why would they give you money? So I mean, it's basically that. But the nice thing is if you go like on autopilot, like not really putting much effort, like you would get your daily guaranteed easily, and production wouldn't really matter at that point. That's really that's me doing bare minimum, like barely trying out work. Like if you put in like any effort, with Aspen Dental, it's really easy to hit production and go way more over than what your like expected salary would be if you weren't getting any sort of bonus. So it does make a huge difference.
So, obviously on top of that too, the idea of the production part, obviously you're not getting paid on production, just to clarify that, right? You're getting paid your daily guarantee rate on top of profit sharing.
Yes, that's what it is. Yeah.
Yeah. And so just to briefly talk about that, because it is a very complex discussion. Profit sharing is basically an opportunity for you to act and be almost a part of the ownership side. So however successful the office is doing, that's your opportunity to feel that ownership side. So if the office is doing really well, then you're going to do really well financially. Additionally, everybody in that office is going to be successful together. There's not one individual production rate, even though you are the only doctor that's in there. Typically, if there's multiple doctors in there, there's still only one production rate. Can you clarify a little bit on how the rate goes for the entire office?
I was gonna say, and that's why you want to be the MCD, because the MCD is kind of dips into everyone's, because you're running the office, so you take a bit of everyone's share. So that includes the hygienist, any other doctors that are working there, the oral surgeon, anyone who comes through, because they're contributing to your like net pot of profit. So then, and then you get a percentage of that. And at first I was always like, oh, like is a company really going to be fair with that, or are they going to give you like a really small percentage? I realized it's extremely fair, like much better than I expected. Like, so I was going to say like a lot of your income can come from that portion.
Yeah. Typically the daily guarantee rate is kind of the lowest amount that you could possibly make, right? With this profit sharing idea, if the office is doing well, you're going to be getting more than that amount of your daily guarantee rate. So, you know, the daily guarantee rate is a great thing to have, especially if you plan on going on vacation or being out of the office. But more often than not, you're going to be a little bit more thinking about the success of that office. And that's where this profit sharing does come into play. So that's enough with the whole financial side. I know that we could probably talk about that all day. Another question, what hours does a new dentist work per week? I know you already said that as a question. And how quickly can I become an owner?
So the owner one I already answered, like
I know.
as soon as you get it. So the only thing is, I would say don't get too excited in your first 3 months, because your first 3 months, you're really learning how Aspen works, you're learning the system, you're learning how to get good at stuff. So like even like the profit sharing is not really there. That's when you rely on your daily guarantee, is like your first 3 months. After that, you pretty much have it figured out. And that's when, you know, you can see like, hey, this is what I'm bringing in. And then Aspen has someone who like reaches out to you and shares with you your potential profits as like an owner. Did he answer it? I don't know.
No, that was good.
Okay.
You know, and on top of that, you know, it's just so complex. And I think more often than not, we try to tell people the financially, you can make anywhere from X to Y, right? And as long as you have a firm understanding of that and you have a willingness to learn the structure, we'd be happy to provide it to you. But you're gonna be making some great money, and I'm sure we can agree there.
Yeah.
Here is a hard-hitting one that just came in. I've heard that DSOs often lay off dentists that are not able to meet the production amounts detailed within their individual contracts. We'll talk about the contracts. Is this true? And what is expected?
Okay, so I can just say for my office, they know you're a new doctor. They take that into account. So they start you off like at a really low number that they would like you to hit. I was scared because I saw the number and I was like, whoa, like how's that even possible? And then I quickly realized that's just the number that they expect you to get. Like I said, it's like without even trying, like it's just regular amounts of patients, you're putting them in your schedule, you're slower, you're getting them done. So I was already hitting their budgets like right out of school. Like within my first month, I was like, oh, like that was it. So and I
And
don't
then
think
how long is your contract?
oh, there's no time length on it.
Say what?
Right? It was I think it was just like you can leave whenever you want. They said if you
Yeah,
don't want to
okay.
work, you don't have to work there.
Yeah, and I'll provide a little bit of info on that. Yes, so we do not have terms of length. So yes, contract is the physical paperwork that you are physically receiving from a legal standpoint, but what we call them are letters of agreement, which basically means you are not tied to a term length, meaning that if you're not happy, then you can leave the following day. Additionally, if we also offer, we don't have non-competes, meaning that if you're not happy and you want to go work somewhere else, you can work across the street at the competitor the next day, which is great. I know for California, there's some legal things about that, but overall, this is a nationwide agreement that we've had for every single office, no matter what office you work at. Have anything to provide any
The
other?
last thing I wanted to say is like I've never heard of a dentist being worried about being laid off by Aspen Dental. You have to be really off. Like you have to like hate extractions, or you have to be really bad with patients. Like there has to be like a really good reason for, and I feel like at that point you would know like I'm not doing a good job. Aspen's really not one to come out and get rid of you at all. Like I've never had a single day where I've worried about being laid off.
Well, that's great to hear. I don't want you gone. I want you to stay here too. Okay, growing and learning. So how have you grown since joining Aspen Dental?
Oh my gosh, you grow tremendously. I was gonna because when I first started, I remember I was like, man, I don't even know how to, because you have to treatment plan so quickly. Like the patient's there, they take the X-rays, and like within 5 minutes they come grab you, and they're like, what do you want to do? And just that treatment planning I remember that was like the struggle in the beginning, like what's the right thing to do, learning what, like where your patient is, what type of patient they are. I mean, that's, I think the biggest growth there is just learning, what to deliver, because at first you want to save everything, let's say, and then you're like, well, this patient, that's not what they're looking for. You have to meet them in the middle. So that was huge. So learning that, and then also learning like the whole business side of it, like how to run an office, how to manage people, because I was never a boss before, and all of a sudden you're a boss of 10 people and everyone's looking at you, and you have to, change the way you act. Like you're not part of like the employees, you're like the employer kind of, and
Exactly.
it's totally different. Like you get treated different, you have to act different. And I felt like I was like, whoa, like what is this? Like when did I sign up for all this? And over time you just learn how to manage it, how to keep the borders between you and your employees like not so blurry, things like that. You'll mess up at first, like things will go wrong and you'll learn from your mistakes, but that was huge. And of course the procedures, you just get faster and better at them, but it's a lot of like the management, I think, where you really grow. And I was like, there's really like no way to prepare other than managing an office and learning from your mistakes.
Yeah, and you'll be learning that throughout the time that you're there. It's not like you need to know all the management stuff day one, right?
Yeah, but it's different. Like if you're not used to ever managing it, which I don't think most people are, it's like a whole new experience of people complaining to you, having to deal with HR, like all these other issues that you've never had to do before.
Well, since we have a lot of UC San Francisco students on, like, what was your experience of practice management or the business side of it prior to starting with the company?
Oh, I feel like there was none. I was like,
I
I don't
didn't
know,
say it.
because you're just managing like 2 people a day. Like that's so easy. Like you have 2 patients a day, and like that's all you manage. Whereas here, you have to manage all these patients' personalities. You have to talk to your regional manager. You have to talk to your lab technician. You have to make sure your front desk is talking to patients correctly. You have to make sure dental assistants have everything ready. And there's going to be times where people need to be talked to, and you have to be like the bad guy. And I don't
So
know.
how did you learn that when you first started?
Oh my gosh, I think it was hard because it's so awkward. Like having to have like discussions, like one-on-one discussions with people. But I felt like the thing that was the best was telling them like, hey, we're on the same team. I want this company to work for you just as well as it's working for me. Like I want it to be a good environment. And I always told everyone like, I want you to want to come to work. Like, what can I do so that you feel that way? Because I kind of came into an office that hadn't had like such a positive like energy, I would say. And so then I kind of had to change that, because that's not the type of energy I wanted in my office. I just felt like I want everyone like happy to go to work. And so then that was a struggle. But after a few months of, just maintaining it and maintaining expectations for that, like not allowing kind of like bad behavior, um, it worked out really well. Like once they understood, like you're on their side, you're theirs. So, they can have a good time doing their job while you're also doing it.
If that person's successful, then everybody's successful, right?
Yeah. So that worked really
So
well.
that's good. So you mentioned treatment planning. We got a question. Will I do my own treatment planning?
Oh, absolutely. It's like it's your plan, like 100%. Obviously, the first 4 weeks of training, that's where you really learn how to like hone in on how to treatment plan quickly, like what to focus on, how to present it. And then after that, you kind like I said, then you're like, I'm the only doctor. So every single exam goes straight through me. And if another doctor has done a treatment plan previously, I'll just be like, hey, like you're transferring over to me. Let's come up with my plan. And, if you're comfortable with that, let's proceed. Like, I don't even like to go off of other people. So anytime someone comes from a different Aspen, they're like, I just had an exam 6 months ago. I'll be like, well, that's their plan. I want to, I want to do mine. So I just start over.
That's awesome. Making them understand
Mm-hmm.
why you're doing it and
Yeah.
understand, like, you know what? Everybody practices differently, and this is kind of the way that I observe it. So that's great. Okay. So I want to be respectful of everybody's time. It's about 7:17. We're only going to be about 5 to 8 more minutes. The final thing that we're getting some questions on is regarding kind of what's been going on with COVID and how we've been handling it. So, a little bit more of the safety and technology side. So, what sort of changes were made in order for you to see patients during the whole COVID situation?
Yeah, so we were like one of the few offices that stayed open. Like most of them had got shut down. They're all reopened now, but initially like that was what happened. So then they sent all like the resources just to, because there wasn't enough in the beginning. So they just sent us all the resources, which was like our N95 mask, KN95s. They sent us all the information. I mean, as they were getting it, they were updating us. So, at first it was like, oh, this mask is fine. They're like, no, now this mask. Now you need a face shield. So they sent us face shields, mask. We were stocked up on gloves. Like we just had stocks of everything. I think just because it's being a corporate, it's a lot easier for them to provide us with everything. So I never felt like I didn't have the supplies needed to do my job. And then, of course, we had to make up new rules like one patient has to come in, check in, they're put to their room, then the next patient, but patients like never cross paths. Staff is supposed to stay 6 feet apart. Of course, there's limitations. If you have a dental assistant, they can't assist you from 6 feet away, but at least everyone's wearing a mask in the room. So there is always like a compromise, and like everyone understands that like you always have to, compromise a little here and there, which is obviously that you are working in close proximity and your patients don't have masks on, obviously, because you're working on them. But all the safety supplies, like they are there.
So, and you feel like you have a good amount of control over the safety of that particular office?
Definitely. Like if something's ever off, like we address it immediately. I can, like as soon as I say something, it's taken care of.
That's awesome.
Yeah.
Are you using teledentistry, and did you ever use it before?
Oh my gosh. So I didn't use it, but other offices that closed did use teledentistry. So they were able to like prescribe antibiotics. I don't know, just like really simple things, but I don't think we really use it.
That's great. Yes, there are other doctors that have done teledentistry, but your office in particular did not do any teledentistry stuff.
Yeah, but if it ever like was to close again, then they switch over to teledentistry just because emergency patients, you don't want to leave them without anything. Otherwise they just go and clog up like emergency rooms. So
Exactly. So a couple more questions. We're about to finish up shortly. How did your interview process work?
Oh my gosh, so I didn't even know I was being interviewed. Yeah, I was gonna say, because I was at that Aspen event. Is it Edge or Vibe?
You're talking about Vibe.
Yeah, it was Vibe. Yeah, so
feel free to talk about Vibe too, if and a little bit of your experience from that.
Yeah, so I was under the impression it was like we're just going out there, seeing what Aspen's about, what it has to offer, and then they were like, oh, and then you like get to talk to a couple different doctors. So I thought I was just talking to them. I didn't realize I was being interviewed, which is probably a good thing. So they asked me, which area am I interested in working in? And I always said, I'm like West Coast. I want to be close to California. So then they put me with like doctors from like the Pacific Northwest, which I got Dr. Garnichet, who's works like 3 hours north of me. And she has a mega office where she has like 3 doctors. She runs like one of the most successful like practices. So I just asked her like regular questions like, oh, what's the day like? And she was just, I think what really they're looking for is someone who's like ready to learn, has a positive attitude, is willing to like work hard, because all the dental skills can come, but the other part is like stuff that kind of has to already be in place. Like if you're like not adamant, like if you don't want to see 30 people a day, if you feel like that's something you could never do, like if that's not your personality, like you're an introvert, like I don't know how that would work. And I think that's the stuff they're kind of looking at, because a lot of it is if you can't get your patient to buy into their treatment, then there's no work to do.
That's some great advice, obviously, that, we kind of covered that as well. But what about as far as visiting, did you do an office visit? And when they decided that they wanted you, how did that process go?
So I didn't do a visit because I'd already been here before. So I knew what I was getting into. I was looking for somewhere with like very little distractions. Like obviously coming from UCSF, that's like a super fun city. And I was like, no, like for a year, I want to be somewhere where like there's no distractions. Like I just go to work and I really focus on it. And I knew it'd be tiring because it's a lot to learn really fast. And I got exactly that. Like I'm out kind of in the country, like there's not that much to do, but everything's a plane right away. Like there's a plane, I can get on it and go anywhere within an hour. And that was like something else that I asked for. So this was like the perfect location. But I did mention like only for a year. So that's why they are turned me over to Portland. I was like, okay, Like that's all I can do.
But the nice part is that they did work with you with that idea, right? So, I mean,
He did.
Jim Medina, and he kind of,
Yeah, they all respected it. They were always looking out for an MCD that was leaving so that I could take their spot. So like the moment that opening was there, they were like, "Hey, do you want it?" I was like, "Absolutely. Like I'm ready to go."
that's awesome. Well, that concludes all the different questions that we have. So the final question I would ask you is, what is your recommended, if you watch TVs or movies, what is your recommended TV or movie currently that you recommend everybody go and see?
I don't know. Okay, so here's
That's my question.
No, you know what's funny? So when I moved out here, I was like, man, like I don't know what to do after work. Like it's so much time. So I found like the longest TV series, which was like Grey's Anatomy. So I started that from scratch, and I finished that just because like it's true. Like I just don't know anyone out here. I was just like doing work, so that was what I did. I was like, there's no movies anymore.
Well, you know what? Everybody that hasn't seen Grey's Anatomy, go out and see it, because that's Dr. Alpert. And again, it's Dr. Alpert with A, not Dr. Halpert, like Jim Halpert from The Office. And just to let everybody know, well, I don't know. I'm going to leave this up to you. Do you want to tell everybody what the H stands for in your middle name?
Oh, it's Henry.
Yeah, there you go. So just so that there is no more confusion regarding that. But thank you so much, Dr. Alpert. I'm giving you a clap, and hopefully everybody's giving you a virtual clap.
Yeah.
Real quickly before I go, I'm going to leave Dr. Alpert's contact information. Again, one final time, we are offering free CE opportunities for all current dental students and all current practicing doctors, whether they're with Aspen Dental or not with Aspen Dental. You just got to go to aspendentalce.com/welcome, and they'll provide more information on that, which is super awesome. And finally, last but not least, if anybody has any questions, there's my contact information, there's his contact information. Do you have any final words or final tips or final advice for anybody before you take off?
I guess I'm trying to think. I think you should just really find the company that you think works for you. And like if there's one like you want to grow in, like make sure like it's one with like advancement opportunities. Because I just felt like that was like the best thing I did was just find a company where it was like good to advance on. And like one that will actually do what you want to do, where you'll be happy doing it. Because otherwise going to work 8 to 10 hours a day is like not going to be enjoyable.
I agree. And I'm sure everybody can see, if anybody knows me and knows you, how much fun we like to have doing this. So, hopefully you can all see that from it. But again, thank you. We're not worthy, Dr. Alpert. If you have any questions, again, feel free to reach out to us. We'll be sending out a thank you with this recorded. So if anybody has any other questions with that, please feel free to reach out to me directly, or feel free to email Dr. Alpert. Again, thank you so much. And this concludes everything. Have a great day, everyone, or have a great night, everyone.